talk today. You are all very welcome indeed. So just a little bit of an introduction about our health talks. This event is set up for our members to give you practical advice and information about health-related topics from our specialist teams. I'm going to introduce Helen Phillips in a moment. She's our drug, alcohol and smoke-free lead for the Trust. And Helen will give a 40-minute presentation on Stoptober, which is a national campaign to encourage people to quit smoking. Just a bit of housekeeping before we start in terms of how the event will run. Please could you all make sure that your microphones are muted and cameras off throughout the event to make sure it runs smoothly. And you are free to use the chat function to ask questions, and we'll be answering those at the end of the presentation. So please do submit your questions during the event in the chat. And the event will be recorded and posted on our website to share with members. So on that note, I'm delighted to welcome Helen. Over to you, Helen, about Stoptober. Thank you.
Thank you, Alex. Yes, as Alex has said, I'm Helen Phillips and I'm the drug and alcohol and smoke-free lead here at Prospect Park Hospital. And the Trust has actually been smoke-free since 2016. As you can see, we're proud to be smoke-free. And that really is to help improve the health of our patients and staff and visitors and protect them from secondhand smoke, which causes, disease and illness. We do know that secondhand smoke is a carcinogenic. It hasn't always been the easiest of journeys, and there's always a lot of debate about whether smoking is a lifestyle choice or not. But really, we want to be thinking that smoking is an addiction. And it's not a choice. Most people who want to stop smoking just find it really difficult to do that. And I include myself in that. I'm an ex-smoker, and it took quite a few attempts before I was able to kick the habit. People have many attempts before they're successful. But being smoke-free in the Trust helps to reduce the pressure on the health services as well, supporting people who come into contact with our services to stop, and help, lowering smoking-related illness and hospital admissions. We're all clinicians here, and really we're champions of health and well-being, which is why we're really encouraging our staff and patients to quit. And Stoptober really aligns with this. It's a national commitment working towards a smoke-free future. And that's why we're raising awareness again here today. So it's a very basic overview of the trends of smoking, which I'll cover. Have a look again at the health consequences of smoking, having a think about what exactly is in a cigarette, why it's hard to quit, what we can do that will help, and vaping. There's lots of myths around vaping, as we know, and the support that you can get locally. So why are we still talking about smoking? Well, in 2022, about 30% of all deaths were smoking attributable, and it's still the largest cause of preventable early death. In England, as you can see there, about 200 people die every day from smoking-related disease. Respiratory things like lungs, and trachea, and bronchial cancer, COPD, pneumonia, heart disease, other circulatory issues, digestive issues, and we know that the longer you smoke, it reduces your life expectancy by an average of about 4 to 6 hours for every cigarette smoked. So there is a downward trend. I'm sure you probably see it out and about. We don't see it as often. We're not allowed to smoke in areas that we would have been before, in bars and clubs and restaurants, etc. So as a result of this public health message, there has been a downward trend. But we still have, this number is actually old, it's about 12% now that people that in England are smoking, and there's now twice as many ex-smokers as there are smokers. But still, smoking remains the biggest driver of health inequalities, with people from the most deprived areas still twice as likely to smoke than people in the least deprived areas. And who is still smoking? Well, The age group really is young people up until the age of 25 is about 23%, and this is 2018 data. I appreciate you might be able to see it that clearly, but what we see is this decline then steadily through life until this data is shown over 60, which is about 10% of people that are still smoking when they're over 60. Men are still more likely to smoke than women, and routine and manual occupations are more likely to smoke than people in managerial or professional occupation. Now, the smoke-free generation the government aim, is to have less than 5% smoking by 2030. Our patients who have a mental health condition die on average about 10 to 20 years earlier. And largely these are due to smoking related illnesses, which are the largest factor. Our patients with mental health issues have an increased risk of heart disease and strokes. They're much more likely to have diabetes, or 10 times more likely to die from respiratory disease than the general population, more likely to suffer from asthma, chronic bronchitis, emphysema. And they have also the worst cancer survival rates. So also an increased risk of oral cancers, throat cancers, and really within our trust we've had a real focus, and nationally we've had a focus on this group of people alongside those routine and manual workers and people that are in maternity services. So those are the main groups that services are focusing at the moment because of the high prevalence. It exacerbates poverty. You know, we know that cigarettes cost between, I think, about 13 and 18 pounds, maybe up to 20 pounds, depending on the brand that you smoke. And a person with a severe mental illness can spend up to a third of their income on cigarettes. So it really does put people into below the poverty line. And I know from our patients that have quit successfully, it's the first thing when we do our feedback that they notice, having more money in their pocket, more money for groceries, more money for clothes, and just for those nice things to treat themselves is definitely a huge factor as far as motivation is when thinking about quitting. So people that are smoking also have higher rates of depression, higher rates of anxiety, panic attacks, and stress. They spend longer times in hospital. They have more symptoms, severe symptoms of psychosis. And I think actually the recent research suggests that smoking increases the risk of becoming psychotic or depressed in the first place, definitely at an earlier age, maybe for the onset. So we have a huge responsibility here to try and work with people and support them as they come into BHFT, understanding where they're at in their smoking and trying to give support to move towards quitting. And our patients with ADHD, there's a huge prevalence, you know, in comparison to 14% of the general population, which I've said now that number is old, about 12%. It's about 40% prevalence for patients who have a diagnosis of ADHD. And the quit rate is lower as well for, you know, people in the general population is about a 48% quit rate, whereas people with ADHD is about 29%. There is some work around looking at nicotine as a stimulant, which can help maybe with symptoms and improve focus or sharpen memory or improve cognition, but it also might help to reduce hyperactivity and impulsivity. So, as I've mentioned, smoking is the leading cause of preventable death and disease in the UK. And this remains at all age groups, higher than obesity, alcohol, road traffic accidents, for example. And I think it was about 17% of all deaths of adults were attributed directly to smoking in 2022. So it has a huge impact on certain, as we've mentioned, certain diseases. Those are respiratory deaths and cancer deaths and cardiovascular deaths. And because of the impact of the poor health, it's costing the NHS about 2.7 billion a year, and the social care system around a billion a year. And I think we mentioned earlier is about 200 deaths a day. They're saying more focused, maybe 9 deaths per hour approximately. So we have a lot to do to try to help people improve their health and well-being. And I mentioned earlier about passive smoking. We know it's a carcinogenic, and there are 12,000 deaths a year due to secondhand smoke. And the government bringing in the bans on smoking in public places have really been a major driver in reducing smoking prevalence and obviously the risk associated with secondhand smoke inhalation. And just mention there the maternal smoking, which contributes to about 5,000 miscarriages a year and premature births as well. As I said, maternity services, mental health services, and routine and manual workers have been a real focus nationally, given the high prevalence of smoking and the impact that it has on these groups. So, if we were to think about what's in a cigarette, and I know when I was a smoker, I used to see this and not think anything about it. It was a habit and an addiction, really. But there's just over 4,000 chemicals, and those chemicals are anything from butane, arsenic. I can't really, I'm not sure you'll be able to see that, but the ones that we really want to concentrate on is the nicotine, obviously, which is the drug and which makes it addictive. And this is what people are addicted to, making it difficult to stop. Then we have the tar, which is the main carcinogenic component of tobacco smoke. And this stays in the lungs. Up to 70% of tar that's inhaled stays in the lungs. And of course, it can have an effect on metabolic rate, especially around some of our patients' medications, antipsychotics, to name one of them. And there's a myth around that if you smoke low tar cigarettes, they're safer than high tar, and that's not the case. Also, carbon monoxide, which is an odorless, colorless gas. If you're a smoker, about I think it's 15% of cells can be carrying carbon monoxide instead of oxygen, which making it more difficult to breathe, and where you might start to feel a wheeze because your body doesn't have the full amount of oxygen, and it has to work harder. Your heart has to work harder to make sure that the oxygen is pumped around the body. And actually, our carbon monoxide readings are one of the first things that you start to see changing whenever you quit. So it's something that we do with our patients here when they come into the services at Prospect Park. So why is smoking so difficult? Well, it gives pleasure. People associate it with pleasure, and that's because when you inhale a cigarette, it works on the dopamine, and it's part of the reward pathway, which makes you feel relaxed and gives you, pleasure. So people enjoy it. Cigarettes deliver that nicotine to the brain very effectively. And but what happens is, because of the low half-life of nicotine, the nicotine levels then start to drop. And after that, you start to have the cravings for nicotine, which means that you need more nicotine to satisfy the cravings. And then you have this cycle of addiction, which is very difficult to break. Of course, we know there are other withdrawal symptoms as well, like restlessness or low mood. Sometimes people complain of poor sleep, increased appetite. So it's important to, when you're thinking about your smoking, when you smoke, the times that you smoke, and be more mindful of when you smoke, so that when you go to address your smoking, you're able to say, well, actually, is that morning coffee one is the one that I could really struggle to do without? Or are you just smoking as part of a social thing? Outside pubs or bars, for example, people go out and it's quite social when you're chatting. Do you smoke when you're angry? Are you smoking when you're waiting on the bus, or other times when you're hanging around? Is it the first thing you think about? It's lighting up a cigarette. Are you smoking after a meal, when you're bored, after sex, at a party? So it's quite important to have a think of when you're smoking, what times of the day you're smoking, and if you were to think about starting to cut down, which ones would you find most difficult? We also look at kind of the level of addiction, which, when you're smoking, if you're having a cigarette within maybe 5 minutes of waking up, then that would indicate that you do have quite a level of dependence on the nicotine. As I said, luckily, we might all experience these symptoms, but they're all temporary. Yeah. And you can see that the majority of symptoms are resolved within 4 weeks. That irritability and depression, restlessness is gone after 2 weeks. But people do find their appetites increase, and that takes a bit longer to leave. And the nighttime waking, which is one of the ones we see here in the hospital, if people aren't smoking like their normal routine, is that waking up at night. And the actual urge to smoke disappears after a couple of weeks as well. So what we really want to do is think about what we can do to make our patients successful. I know, as a lived experience smoker, that it took me quite a few times to before I actually kicked the habit. We know that using willpower alone doesn't really work. And sometimes I know I did it myself. I think, okay, from Monday, I'm never having another cigarette. And what we know, research shows that this really isn't enough. The most successful way to quit is to use prescription medication or nicotine replacement and have the support of your local stop smoking services. Kat, I'm wondering if we could have our first poll. I'm going to ask you to do some work here about whether stop smoking treatments work or not. If we have a true or false, to see what people think in the room. If you're able to post that, if you don't mind, just let me know.
It should be posted now, Helen.
Yes, it's there. Thank you, Kat. Yeah, so we do hear this quite a bit. Oh, patches and stop smoking treatments, they don't really work. What's the thoughts in the room about this? Just let us know. Thank you to those of you who responded. Yes, so there are some people in the room that still feel that this is a true statement, that some of these stop smoking treatments don't work. And I think if you had asked me a few years ago when I was going through this, I might have said similar. And I think it's probably because we're not always using them as they're meant to be used. And I'll come to that in a bit. And there is this thought that if you use more than one NRT product, or if you're vaping and using NRT, then it's dangerous, which we'll come and talk about in a bit. But no, as I said, using these replacements with either prescription medication or getting the support from your local service, having a patch which helps with the kind of slow release. So you might have a kind of keep your blood nicotine levels at a certain level. And then when you feel that really urge to have a cigarette, you can use one of the quicker acting things like the gum or the spray or a vape, and we'll come to that. And it really can double a person's chances of stopping smoking. And there is a wide range, so there's a lot for people to choose from. As I said, the patch is the long-acting one, and it's usually applied in the morning after a shower. If people are smoking about 20 cigarettes a day, then you would have a higher regime, and that comes down lower depending on what your daily smoking is. The lozenges, sometimes we don't use them properly. You just let them sit in your mouth, really, and they take about 10 to 20 minutes to dissolve. But again, We're not always told exactly how to use it. It's exactly like the gum. You chew it, you break it up to release the nicotine, and then you just park it and wait. And the peak of that should be about 20 or 30 minutes. And the fast acting spray, it's fast acting in its fact, you'll get the impact within about 12 to 13 minutes, and you spray it into your cheek or onto the tongue, so it's absorbed really quickly. There are also nasal sprays, but people don't find those as popular really. So there is a vast array, and it's how we use them that helps us to make sure that they're successful in managing our nicotine cravings. So as I said, as this gentleman here, he's smoking between 30 and 40 cigarettes a day, we would really recommend combination therapy. Very effective, high level dose patch, which keeps your nicotine blood levels, slow release throughout the day. And then when you get that craving or you have that urge to smoke, then you can use something that's really fast acting. And that can be as any of those other products that I've mentioned, or it could be a vape. And if we know that vaping is extremely popular now, I'm going to talk about vapes in a bit. We also have some prescription medication that is available from the Stop Smoking Services or from your pharmacy. And you may have heard of this one, varenicline, which is kind of known as Champix. And this also helps to reduce cravings and withdrawal symptoms. And as you can see, doubles or triples the quit rate compared to a placebo, but also you need to have that behavioural support from your local service, helping you manage your cravings and helping you look at your triggers and when you might be most vulnerable to smoke. You can usually start this about 1 week before you quit. So I guess then you have some levels in your blood before you actually set that date to stop. And then you would usually take it for about 12 weeks. But again, as you can see, highly effective, double or triple your rate. And you can get this from pharmacists or your local Stop Smoking Service. We have another one that's been it's been used longer in Europe than here. I think it came here for use about a year ago. And again, it works the same way as the Champix, helping to reduce that withdrawal. But the thing with this one is it's shorter length in treatment, about 25 days. So it's much quicker. And the efficacy is really much the same as what it is as varenicline. And in the hospital, we're not using these at the moment. So we would be looking towards the Stop Smoking Services across Berkshire or your pharmacist or GP to access these. And so then let's have a think about vapes. They're really popular. We have about 2.6 million users, and as you can see, a third of those are ex-smokers, and 2/3 of them are still current smokers. And there is really a role for this harm reduction, and we do see people coming through our services that maybe came in smoking 20 or 30 cigarettes a day, and they've tried to swap over, and as a result, they might smoke 5 cigarettes now, and the rest of it is vaping. And we kind of encourage this harm reduction approach as well within mental health settings, because we do find that our patients are more addicted and do smoke more heavily than the general population. So if we can start to do a plan of reduction and switching over to vapes, then that is quite a success for us as well. Usually they have a cartridge with e-liquid. Some of them you can top up yourself. Sorry, I just saw that come in. Sorry, Eve, I'll have a read in a wee bit. The disposable vapes that we've seen, which were so popular for many years, have now been banned, and you will only be able to buy a rechargeable. And the way you can use those is either with an e-liquid refill, or they will have already got that cartridge in, and you just take the cartridge out and then refill it. So hopefully to reduce the amount of vaping going into landfills. They weren't very ecologically friendly. They don't burn tobacco, so they don't produce tar and carbon monoxide. And of course, it's really, really important that it is purely as a stop smoking tool for adults over 18. They are illegal to buy or supply to children under 18. And if you've never smoked, please don't vape, because obviously it's better than to put nothing into your lungs than to vape if you've never ever smoked. Can I do another poll, Kat? Poll. This one is, and just see what people are thinking in the room. Vaping is as harmful as smoking. Can we just see what people think about that statement? Thank you. I can see it now. Hopefully everyone else can. Okay, thank you to those people that have responded. Vaping is, well, it's not obviously 100% harm-free. It's 95% safer than smoking. And the reasons for that is because you're not inhaling those thousands of toxins, and especially the tar and the carbon monoxide. So that's why we do say it's 95% safer, but this is absolutely a myth that goes out, and some people think, oh, it's just as harmful as smoking. I'm going to be addicted to the nicotine just as much as I'm going to be addicted to the cigarettes. But actually, it's how you have your nicotine. If you're having it through a vape, it's a cleaner form of having your nicotine than smoking it through a cigarette, where the smoke can cause damage, and of course the tar and the carbon monoxide, which is part of the cigarette and part of that burning of the tobacco inhaling. Can we do another one? Kat, nicotine is harmful to health. Thank you again for okay, thank you, as I said, for that. I think we're finished, are we? So there is an overwhelming thought in the room that nicotine is harmful to health. So this is another myth, really, because nicotine in its own is a relatively clean drug. It's the tar and the carbon monoxide from the cigarette smoking and the burning of the tobacco, which is the part that causes the respiratory diseases. And nicotine on its own doesn't cause cancer or COPD or any of the other respiratory diseases. It's addictive, but it's relatively safe in comparison to what we're doing when we inhale tobacco smoke. I did have another one, which I think is another myth that comes out. Oh, I've given it away now, haven't I? Vaping causes popcorn lung. Kat, could we do that one? See what people think in the room. Okay, nearly there. I'll let the results come in. Okay. Oh, look at that. It's a 50-50 split. So this one, popcorn lung is really something that we see in America more. All the vapes that come into this country are regulated by the Medications Regulation Authority, and the substance that causes the popcorn lung is a banned substance in this country. And that's why it's really important to make sure if you are buying a vape here, that you buy it from a regular outlet, because the MHRA are very strict on the substances that are gone into manufacturing the vapes. And this has been an issue in America. And I think actually there were some deaths in America, but when they looked at the profile, it was people that were under 30, and most of them had added something to their vape, so they hadn't got them from regular outlets. So it was really huge, a big thing, big message to get across. If you are going to vape, make sure and buy them from a regular outlet. And then the risk of these kind of impurities or banned substances being in the vape is is non-existent, because they're banned substances in from the regulated outlets. So just to cover that, vaping is as harmful as smoking, as we said. It is 95% safer. As we know, this tobacco smoke has all these chemicals. E-cigarettes don't have the tar or the carbon monoxide, which causes the cancers, the lung diseases, and the strokes. And in fact, vapes are supported by the Cancer Research and other cancer societies. And the nicotine is a relatively safe, is the way that we take it in. Oh, sorry, I didn't mean to do that. And the popcorn lung, as I said, the banned substance, which I think is diacetyl, is a banned substance in this country. It's not allowed as an ingredient in the UK for any vapes or any e-liquids. So even though the illegal vapes might be cheaper, you are really uncertain about what's in them. So stick, please, to a regular outlet, and you will be safer as far as these ingredients are concerned. So, as I said, we do have misconceptions around smoking. Smoking helps me deal with stress. And I think when I spoke about that addiction cycle, you can often see how that stress may well just be part of that withdrawal, because the nicotine is such a short half-life that once it starts to leave your system, you start to feel stressed. And then so you need to have another cigarette, and then you feel that you've relieved those symptoms just by having another cigarette, which of course is likely and more likely to be just that nicotine hit, which is helping you to feel better as part of that addiction cycle. So it's really situational, and is purely relief of withdrawal symptoms. So that's a bit of a myth that we like to dispel here in the hospital. I'll put on weight. As we said, there is that risk of an increased appetite, and some people do put on an average of 4 or 5 kilograms. But when we're talking alongside reducing weight gain by healthy eating and exercise, it's easier. Sometimes people say they find it easier because stopping and smoking improves their lung capacity and their lung function, so it does make exercise easier, and so they can start to address that weight gain, because the risks of a slight weight gain are much less than to continue smoking, which we do know has a real impact on health. Switching to roll-ups, again, no, because we're still burning tobacco and we're still getting all those impurities and toxins from a roll-up. So that is a myth that people think, okay, I've switched from tailor-mades. It's not a healthy option. It still has tar and carbon monoxide, which doesn't reduce. It's not reduced because you've switched. And then I've tried before, and my chest gets worse when I stop smoking. Well, what they do find, and what I found, is that people do start to cough a little bit after they've quit smoking, but it's really clearing out your lungs and getting rid of all that gunk and getting it out. But usually that will settle after 4 or 6 weeks. So yeah, don't be put off by the fact that you think your chest will get worse. It's actually the opposite. It just clears out all that gunk and helps your lung capacity. And as we mentioned before, about 15% of cells can have carbon monoxide going around the body rather than oxygen, so all that will change. I just wanted to mention cannabis because we do see people that smoke cannabis, and sometimes they don't always see themselves as a smoker, but it is the most widely used drug in the UK, and people use it with tobacco. So, just to be aware that if you're trying to quit and you're still smoking cannabis with tobacco, then it can hamper any kind of quit attempt. So really giving up completely brings us benefits. But if you still wanted to vape and to smoke tobacco and you weren't ready to stop, then obviously from the harm minimization approach, you'd rather use a vapor than using it with an e-cig or an e-cig rather than using it with a cigarette. So having a date is a really good thing. Yeah, sort out your NRT, sort out which service you're going to use. Think about whether you're going to use the swap to stop. Think about why you want to stop. Have a plan. Speak to people around you so that people are aware. If there's any support groups on Facebook, or we have an app here called the Bella app, some of these can work. If you stopped before, which I did before my final attempt, think about what was really good and what helped you. Think also about what caused the relapse. And don't get discouraged if you do relapse. These things happen, you do slip up, and that's part of that cycle. It's just about remembering why you wanted to stop and what your motivation is. Make sure that you have all your NIT ready. Your stop smoking service will have that delivered, and the quit date can be set, and you can have everything ready. Knowing your triggers is really important. And as I mentioned before, if you usually have a cigarette after your morning coffee, or you usually have a cigarette while you're waiting at the bus stop, okay, think about what you're going to do differently and how you're going to manage those now that you've decided to quit. And the good thing is that stopping smoking before you're 30 can really reduce that the mortality risks the same as a non-smoker. And smoking at any age really does give you extra years of life anyhow. So never give up giving up, really, because the health benefits are not just, we always say wealth and health. And I'll talk a bit now about those benefits. Sorry, I was distracted again by the message coming in. So yeah, after 20 minutes, your heart rate drops to a normal level. So it's very quick. But within that 20 minutes, you may well start to have some cravings. So have something ready, like a piece of gum or something. 12 to 24 hours, that carbon monoxide level drops to normal. So risk of a heart attack decreases significantly. And this is huge within 24 hours of having that last cigarette. 2 weeks to 3 months, your lungs function starts to improve and your risk of heart attacks begins to drop. After 1 year, your risk of coronary heart disease is half that of a smoker. And as you can see, after 5 years, your stroke risk is reduced. And after 10 years, the risk of lung cancer drops to half that of a smoker. And the risk of all the other cancers decrease as well. So it really is an important thing that we can do for our health and well-being. It's a very difficult thing to do, and I know because I've been there, but it's one of the most important things that we can do to help us with our well-being as we get older. So just to mention the local clinics here, we have Smoke Free Life in Berkshire, and if you go on there, you will find all sorts of clinics. They're in supermarkets, they're in lots of different places in your local area, trying to make it more accessible for people. They also offer that Swap to Stop initiative, which is the big government project where we're trying to get people to swap over to vaping. And stop smoking the cigarettes. And some of them offer a 12-week program, which includes both the device and e-liquids. So it's really important, and it can be help with your wealth as well. You get weekly support, and that can either be telephone support or it can be face-to-face. That's very much dependent on what you feel would benefit you. You also get your nicotine replacement. There is that option of the new medications. As I said, they're mobile facilities. They're out and about in your local area. And we do have the Quit with Bella app in Berkshire, which is people do find helpful. Okay, so that's it. If there's any questions.
Helen, thank you. That was a fantastic presentation. I thought I knew quite a bit about smoking and stopping smoking, but this has been really revealing, and I hope for members, and actually great to see clinical colleagues and other colleagues from the trust on the call as well. It's been deeply educational. A really important topic, as you say, for general health and health inequalities. So thank you very much indeed. I've got a couple of questions here, or one question and a comment. So firstly from Tracy, thank you Tracy. How can you best support or encourage someone who may be hesitant to quit?
Yeah, so I think we hear this quite a bit. I think it's listening out for when someone maybe is breathless, or when someone's wanting to do something and they're like, oh God, I've run out of money, or listen out for that hook. What might be their motivator? And think, I think sometimes if people can be a bit resistant, if we say, why don't you stop smoking? You can be a bit defensive about that. But if someone is experiencing breathlessness and they're saying, oh goodness, I can't run around with my children as much. And then it is maybe about being gently putting it in there. Oh, what are you thinking about your smoking? What do you think? Have you had any thoughts about changing that? I've just been to a talk. There's lots of support there. It is, rather than putting people on the defensive, listening out for things that maybe you can hook on to. Or maybe they're finding going upstairs difficult because they're a bit wheezy. Maybe they're finding that they're not having enough money at the end of the month for food or clothes, or maybe for cigarettes themselves, trying to scramble around for some money for that 18 quid to find that next packet of cigarettes. And again, that's not, what have you thought about how much you spend on cigarettes and things like that, and how we could move forward to help you. Sometimes it's a bit scary, the thought of not smoking, but that's what's useful about this Swap to Stop, because you can still switch over and you still have that kind of hand to mouth, that habit that you've got. You're getting your nicotine in a clean way rather than having the tobacco, burning the tobacco, which is taking all those impurities into your lungs. So there are some options. I hope that helps.
Really helpful advice. Thank you, Helen. And then I've got a comment from a colleague, Emma. Thanks, Emma. I switched from smoking to vaping in 2015 with the aim to quit. I recommend the Quit Vaping app if you're at the stage to quit vaping. I'm 2 years and 38 days vape free. Thank you, Emma.
Well done, well done. And by the way, NICE guidelines do say that don't stop until you're ready to stop with your vaping, because it's much better to continue vaping than it is to relapse back into smoking. Yeah.
Great. And thank you, Samantha, for this as well. Thank you so much. I will look into this further now, as when I've tried to quit, didn't realise that I'm classed as heavy and need possible 2 aids.
Sorry, I didn't hear the last bit.
I'm classed as heavy and need possibly 2 aids to quit.
Yeah, absolutely. Combination. Get something that's going to do the slow release, and then have something for whenever. And this is a really common misconception. People are worried about using 2 products. Yeah, absolutely. Definitely. All the research shows that you're going to be much more successful if you combine products.
Great. And Eve says, I woke up one morning and didn't smoke for nine weeks. Fantastic.
Yeah, and again there, Eve, it is about thinking of, what was helpful in those 9 weeks, what was the motivator, how did you manage to do it, and then have a think maybe again about if you relapsed, what was it, that made you turn back to smoke, and have a think about what made you vulnerable.
Great. And Yashawi says, what factors are associated with successful long-term smoking abstinence?
Again, it's making sure that you have the support in place, that you plan it well, that you engage with that psychosocial support, and that you get into a different routine, making sure that exercise is part of it, diet is part of that. And I think it's really about thinking when you smoke, how you smoke, what function it plays, and replacing those. If it's, as I said, I want to dispel the myth that smoking helps with stress, because that's absolutely not true. What you're doing is actually just feeding into the addiction and giving in to cravings and helping to top up your nicotine levels. So it's about making sure that all those times that you might be vulnerable, as I say, after your morning coffee, having a different plan in place. And I totally agree with you, Eve, that things definitely taste better once you've stopped smoking.
Mm.
So engage in the sport that's available, really, Alex. Yeah.
Yeah, brilliant. And then just a question from Emma about stopping smoking immediately, and to the point around Eve stopping for 9 weeks. Is it safe just to stop like that?
Yeah, people do that and go cold turkey, and you'll experience all those kind of symptoms. But what we would say is it's the least effective way of stopping.
Great.
Yeah.
Yeah. Okay. So yeah, Eve, yeah, water tastes better, food tastes better, better health, better all round. Walking was much more fun. And these are some of the benefits. It's fantastic. Julie says, I always get a bit uneasy when I see close friends smoking or family still vaping. Despite my support, I've lost 3 family members and 2 close mates to smoking. So I'm gaining as much information as I can to support them further. Thanks, Julie. Eve says, stopped smoking since 2005 and smoke-free since. So these are really
Well done.
positive change stories. Congratulations, really good. Are there any other questions that people would like to pose in the chat? So John says, does the trust have a self-monitoring kit so progress can be seen? Good question.
No, we don't. I'm not really sure, John, what you mean, but no, we don't have anything. I mean, if you're an inpatient here, we monitor it with our carbon monoxide monitoring, and that's really good motivator. People can really see the difference, because obviously the carbon monoxide is a toxin and has a real impact on cardiovascular system. But no, I don't think we have any.
Outside of the trust, though, Helen, are there other? I would imagine there are other tools and support that helps you track your progress
Yeah, the apps are very good
to
for that.
stop
Yeah.
smoking. Yeah.
Yeah,
Okay.
you can track it on any of the Quit for Bella app, and then I think Emma mentioned a vaping app that she's using.
Yeah.
Those kind of things are really important for self-monitoring, but the trust themselves, we
Yeah.
just, yeah.
And self-monitoring is really important for motivation, isn't it, to see your progress?
Absolutely,
Whatever
yeah.
works for individuals. Thank you. Okay, I'm going to bring the questions to a close. And thank you once again, Helen. That was a fantastic presentation and a really excellent Health Talks event for our membership. We will be putting this recording onto our website, so all members can benefit from this, and any other people that want to see about stop smoking. And on that note, is there anything else we need to say about Health Talks events, Kathy, at this stage?
Only that we plan to now run a series of these events, I think once a quarter, and we'll be advertising them out in due course. I'm not sure if we have our next one, the topic agreed yet. Kat, do you know if we've got that lined up yet to go?
Not yet, but as soon as we do, we'll communicate with members.
Okay,
That's great.
thank you.
Thank you very much. Well, on the basis of this first one, this has been really valuable, and I hope people who've been here and see the video in the future find it really helpful. So we look forward to the next Health Talks event, and I thank you all for attending this one, and wish you well and goodbye. Thank you.
Thank you.